Good morning. Myself Varun Kumar, faculty of SNS College of Physiotherapy. Today we will see about the topic called behavioral problems. Okay. So behavioral problems in rehabilitation, we will deal with the patients who are been disabled person. So disabled person mostly they will dependent on some other persons like family members or caregivers or home nurses, etc. So in that type, the patient will be in a different psychological level. So their psychological status will not be the same. So that they will be have the different behavioral changes with everyone. So as a physiotherapist, when we dealing with that kind of patients, we have to know about their current behavior so that we can able to treat them along with their behavioral changes in order to bring their results. Okay, so introduction. So disability, it often leads not only to the physical impairment but also to the behavioral and emotional disturbances. Okay, so disability leads to the physical impairment and also it leads to the emotional disturbances, and these may arise due to the neurological damage, psychological stress, social isolation, or poor copying the skills. So the management requires for these kind of behavioral problem patients the early identification, counseling, family support, and the rehabilitation strategies. So these are all the management required for the management for the behavioral problems. So the common behavioral problems in disabled persons. So there are some kind of behavioral problems we can see in the disabled persons. In that, first one is the depression. So depression, the features of these depressions are sadness, hopelessness, loss of interest, and then the suicidal thoughts. So the causes for these kind of depressions due to the loss of independence. So the patients will dependent on the other persons. So loss of independence, then chronic pain, and then the social isolation. So the impact for this kind of depression, it reduces the motivation and the compliance with the rehabilitation. So next type of behavioral problem is the anxiety. So anxiety, the features of anxiety are restlessness, fear, worry, insomnia, and then the autonomic symptoms. And also it may worsen the functional disability. So next kind of behavioral problems are aggression and irritability. It both are seen in the traumatic brain injury, dementia, frustration with the disability present. It may result in poor cooperation during the therapy. So this kind of aggression and irritability will leads to the major problems. The patient won't cooperate with the therapist, so that there won't be a better results or better outcome in that kind of patients. So denial. So in this kind of behavioral problem, the patient refuses to accept the disability or limitations, and it leads to the unsafe behavior or non-compliance with treatment. So dependency. Next kind of behavioral problem is the dependency, and there is the over reliance on the caregivers. So dependency means they will be dependent on some other persons. No, so there will be a rely on the caregivers, so that there will be refusal to attempt the independent activities. The patient will adopt for that caregiving activities. So they won't try the independent activities. Then there is a different kind of social behavior called withdrawal and then the social isolation. So in this kind of behavioral problem, it occurs due to the avoidance from the family members or the friends, and it leads to the loss of confidence, and then it may progress to the depressions. Next kind of behavioral problem is the cognitive and the personality changes. So it occurs especially after brain injuries, stroke, dementia. The problems include poor judgment, impulsivity, or apathy. So the cognitive problem will become the main in this kind of behavioral problems. So the principles of management for this kind of patients, there should be a different kind of principles. So in that principles, the first one is the early detection. So in this, we want to detect the behavioral, what kind of behavioral was the patient having. We want to detect earlier by through the screening for the mood and behavioral problems. After detecting, then we have to go for the counseling and then the psychotherapy. Then we can go for the cognitive behavioral therapy. Then medications like antidepressants, anxiolytics, mood stabilizers are prescribed. Then family education, the caregivers should train to the managing the challenges behaviors. Then in reinforcement of the positive behavior, then we have to make a structured rehabilitation program for this kind of behavioral problem patients. So next is the role of physiotherapist. So physiotherapists have to be build a rapport, good rapport and trust with the patients. Then physiotherapists have to use the positive reinforcement to encourage the participation of the patient. Then physiotherapists have to incorporate the enjoyable activities into the therapy. Then modify the goals according to the patient's mood and then the tolerance. And then communicate with the psychologist or psychiatrist regarding the observed behavioral changes. Encourage the group therapy sessions for social interaction. So, case example: a patient with 35 years of old male with traumatic brain injury. So, in different types of behavioral problems, for traumatic brain injury patient, we see that the patient will go for the aggression and irritability. So, here also the patient showing the aggression and poor cooperation. So, for this kind of patients, we can give interventions like the structured therapy with short or clear instructions. Then we have to make the involvement of the psychologist for anger management. Then we have to educate the family members on consistent response and render calm reinforcement. So summary of today's class is disability leads to the emotional stress, which leads to changes in the behavioral problems. So for that, the solution is we have to identify the early identification, then we have to give a counseling, then we have to give a therapy, then we have to support the family members so that there will be a better rehabilitation outcome. So these are about today's topic called behavioral problems. Thank you.